Senator Ron Johnson openly admitted that, yeah, he wants to end Social Security and Medicare as we know it. So this is from an interview that aired on Tuesday on the Regular Joe Show. Now, in it, Johnson had basically whined about people over 65 automatically getting the benefits that they had paid into their entire working lives. Automatically. Here's what he said.
Yes, and defense spending has always been discretionary. VA spending is discretionary. What's mandatory are things like Social Security and Medicare. If you qualify for the entitlement, you just get it no matter what the cost. And our problem in this country is that more than 70% of our federal budget, of our federal spending, is all mandatory spending. It's on automatic pilot. You just don't do proper oversight. You don't get in there and fix the programs going bankrupt. It's just on automatic pilot. What we ought to be doing is we ought to turn everything into discretionary spending so it's all evaluated so that we can fix problems or fix programs that are broken, that are going to be going bankrupt. But because, again, as long as things are on automatic pilot, we just continue to pile up debt. It's mortgaging our kids' future. It's this massive debt burden.
All right, so let me be clear on this. Social Security and Medicare don't add a penny to the national debt. They just don't. These programs are paid for through payroll taxes, and when it comes to Medicare, premiums. And so, look, these programs are also prohibited from borrowing money and are only able to pay out money from their trust funds. Anybody that's telling you that these programs increase the national debt, they're a liar and they want to take your benefits from you. That's it. Now, what actually increases the debt is the constant military spending and corporate handouts. That's it. We spend nearly $800 billion a year in the military, more than any other country combined, and lots of other countries combined. And a lot of it goes, unfortunately, into the pockets of defense contractors for weapons. I mean, I talked about the Jinsu missile, which is a precisely guided missile with a bunch of knives attached to it. That's the kind of weapons that we have. That's where your tax money is going. Instead of getting healthcare, you get missiles that can slice and dice and create julienne fries. I mean, great, but also not great, because I'd rather have healthcare. But anyway, no, if you want to save money in these programs, because there is an issue. Yes, these programs, we have an aging population. We have more people that are using these benefits. And so, of course, there is going to have to be some fixes here, right? To get more money into the program. Now, you don't do that by lowering benefits or raising the age, which is basically, again, stealing money that you would put into the system already. No. Number one, you can, for Social Security, for example, raise the cap on wealthy people. Now, right now, the cap is $147,000 a year, meaning that if you're someone like Jeff Bezos, who is the richest man in the world, you probably make that in what, 2 days? 2 hours? Well, once you do that and pay that in your taxes, right? You don't have to pay any more in Social Security taxes for the rest of the year. You're done. You're done. So if you want to save the program, lift the cap for the rich. And you fund Social Security for the end of time. As for Medicare, well, one big thing that would save money is to allow them to negotiate prescription drugs with pharmaceutical companies. Now, that would save about $456 billion over 10 years and lead to lower prices for drugs for everyone else. Now, those numbers, by the way, they're just based on H.R. 3, which would allow the Secretary of Health and Human Services to negotiate directly with drug makers in the Medicare program for up to 250 prescription drugs each year, including the 125 most costly drugs offered by Medicare Part D plans or sold anywhere in the commercial market. So right there, even though that plan itself is not as comprehensive, you're already saving money. Not to mention expanding Medicare would drop prices, because instead of the private market competing for profits and then funneling that money into executive bonuses and shareholder returns, which is what they do. And by the way, those same insurance companies have massive overheads, which the government does not have. Now, the government, if they were the insurer, the single payer, they would be able to negotiate with hospitals for lower rates at less overhead, reducing the cost not only for the government, but also what you pay in taxes. But instead, Johnson, he says, no. I want to take that money and I want to make it discretionary. Now, what does that mean? Well, for one, it means sending it to Congress to be voted on every single year. So you want Medicare and Social Security to be voted on every single year. Oh, can you imagine how much of a disaster that would be? I mean, look, you already look at the SNAP bill or the Farm Bill, which is what SNAP's the benefits are included in, right? That has become a political football. You really want your retirement that millions of people count on to be a political football in the Senate where any good legislation goes to die? Are you kidding me? No. But the less obvious result here too, even though that would be incredibly disastrous, this would be worse, is that this would, again, make it discretionary. It would turn Medicare and Social Security into a slush fund. So they could take your money that you paid into all your working life and then borrow against it and use it to fund whatever they want. They would turn your retirement and healthcare money into that slush fund. And that would be, again, a disaster. And once it is gone, since it had to be voted on every single year, you think it's coming back? I don't know, maybe in an election year, they'll do a little bit of funding until Joe Manchin comes and, attaches some riders to it saying we need to do more fossil fuel investment and poison pills and all of that stuff. No, absolute disaster. Anybody who is 65 or older, elderly, disabled, you'd be fucked. Of course, let's be honest. I think Republicans at this point would try to keep, everyone over 65. Oh, no, if you're 65, you're 70 years old, then, we'll keep you as is. But anybody else younger, well, we're going to screw you over, okay? Because you're not our constituency. And then they'll tell you, of course, that, oh, no, we're actually protecting Medicare and Social Security. Yes, that's what we're doing while we're stealing from it. No, if you don't want that to happen, don't support Republicans like Ron Johnson, who are looking for so many ways to fuck you over.